Hi, and welcome to today's staff training on brain injury by the Brain Injury Alliance of New Jersey, known as BIANJ. We are excited to have Debbie Edelman, the Education and Development Coordinator, and Dr. Barbara Chabner, Director of Education and Outreach from BIANJ, with us today. Debbie will be reviewing the definition of acquired brain injury versus traumatic brain injury, functions of the brain, symptoms associated with mild, moderate, and severe injury, and barriers to employment and strategies for job seekers to effectively return to work after brain injury. My name is John Takaz. I'm a program planning and development specialist with DVR in Central Office. I'm the program manager of brain injury programs and mental health and substance use disorders. I'm also a contract manager for the statewide Assistant Technology Advocacy Center and Lending Library, as well as a contract manager for 5 innovation and expansion contracts for Employment First Initiative and contract manager for 6 pre-employment paid internship contracts. I'm the DVR representative for the State Rehab Council for the Commission for the Blind and Vision Impaired, and a representative for the Division of Mental Health and Addiction Services, Behavioral Health Planning Council, and a representative for the Division of Disability Services and the New Jersey Advisory Council on Traumatic Brain Injury. I'd like to acknowledge my Chief of Administration Services, Marianne Teasler. And I'd like to thank in advance our American Sign Language interpreters, Corrine Heath and Lisa Pershawn. Please pin the interpreters to your view to make them larger if you need access to them. Our speakers today are Dr. Barbara Chabner, and she has served as the Director of Education and Outreach at the Brain Injury Alliance since 2021. Prior to that, she served as a program manager at the New Jersey Center for Tourette Syndrome. Before returning to nonprofit work, Barbara had a private psychotherapy practice. Barbara has an MSW from the University of Maryland School of Social Work and a Doctor of Psychology from Furkov University Graduate School of Psychology at Yeshiva University. Our other speaker is Debbie Edelman, Education and Development Coordinator at the Brain Injury Alliance of New Jersey. And Debbie has spent her career advocating for individuals with disabilities as well as for their families. Her current role at BIANJ includes working as a member of the Education, Outreach, and Prevention team, in addition to her role as a grant writer. Previously, she worked as a program director at nonprofit organizations in the developmental disabilities field, where she managed vocational and supportive employment services. Statewide, she has increased public and professional awareness about the ADA and has been a consultant for schools, community groups, and health and human service organizations. She promotes accessibility to all community services for people with all types of disabilities. For those attendees of today's workshop who have been with DVRS staff members for over 20 years, you may recall that BINJ had been a DVRS provider organization during the 1980s and 90s. Debbie was the director of BINJ's supportive employment program from 2000 to 2001 and supervised 5 full-time job coaches, job developers who covered 12 New Jersey counties. Debbie joined BINJ's in 2019, and she holds a BS in Special Ed and a MS in Guidance and Counseling. We're so pleased to have both of them with us today, and I will turn the program over to them.
We had each of the job coaches had about 20 adults with brain injury on their caseload. And we used to do the intakes at the local DVR offices when we were given a cubicle to meet our new client. So again, thank you for the opportunity. Before I get into the presentation, there's a couple of takeaway messages. This presentation is not heavy in stats, but you will notice that stats regarding people with brain injury often go unreported, undiagnosed. Many people do not seek medical attention. We know that it is an underreported disability. It's a hidden disability. And for many reasons, people sort of sweep the problem, mild and subtle symptoms after concussion or brain injury, do not seek medical help. And so the numbers we know for certain are underreported. The problem goes untreated. And something to keep in mind when thinking about your caseload or your referrals. If you're not asking the question, we're going to pose with you today some of the questions that you might want to ask to get more information about history of concussion, history of traumatic brain injury in the people that you're serving. We're going to be getting into some specific questions that you can ask. I also wanted to make the point before getting into the PowerPoint that a concussion is a mild traumatic brain injury. Sometimes we use the term concussion, sometimes we use the term mild traumatic brain injury. About 70% of traumatic brain injuries are concussions. So they're really synonyms. You'll hear me use both terms. Also something for you to keep in mind. There's also some distinct issues when you guys are serving people who have had a brain injury who are considering returning to work. These may be in who have long work histories and lengthy resumes and who are having difficulty adjusting to loss. These may be people who stepped off the curb at the wrong moment in New York City and were hit by a car. Tragic car accident, tragic car crash, changing their lives, and so on. I think that adjustment to loss also is a big part of what you may naturally tie into your counseling skills. And also as we proceed into the presentation, if you can think about if you have ever served a client who has had a brain injury, what challenges did you face? What barriers did your clients face? And of course, any thoughts that you have, you can share with us in the chat, share with the whole group. We'd love, and in a few minutes, we're going to open mics and do a case study, and we'd love to hear any thoughts that you have regarding barriers and challenges to serving people with brain injury. If you feel that you've ever, or if you can recollect that you've had a person with a brain injury on your caseload. And just a very quick story about someone that the brain injury, I will never forget this quote. One of our full-time supported employment specialists many years ago had a client who said to them that their family member said, I'll never forget this quote, "Your bruises are healed, your casts are off. Why are you lying around on the couch all day? Why can't you get back to work?" And I've never forgotten. I've never forgotten that. So I think I'm going to do share screen and get into the PowerPoint. Hold on 1 second. And I hope everybody can see that. 1 second. John had mentioned the some of the objectives for today's presentation. We're going to be talking about defining brain injury and its consequences, defining barriers and challenges for finding and keeping a job after brain injury, identifying strategies for job seekers to effectively return to work after brain injury, and the last part of the session, identifying resources for job seekers, who have a brain injury. We're going to be reviewing BIANJ programs and services and a in-depth description of the New Jersey TBI fund and how that funding source can help any referrals that you have that have a brain injury. So we'll start with this. A brain injury is not a congenital, degenerative, hereditary, or induced by birth trauma. Common questions are, differences between acquired brain injury and traumatic brain injury. Acquired brain injury is an umbrella term. It includes injuries to the brain that have occurred after birth. These are just examples: anoxia, stroke, aneurysm, infection to the brain, toxic exposure. I'm
sorry, Debbie.
Yes.
And I think I can't see the PowerPoint, and seems like a lot of other people can't see it.
Okay, hold on.
So
okay, thank you.
Let's try to see if we can adjust that.
Let me back up. Thank you.
I'm not sure why we can't see it.
Okay.
Hold on.
Let me hold on. Let me go back into share screen. Oh, share screen. Screen. Now I just have a black screen.
We can see it now.
Can you see it now? I can't see it.
You can see it, but it needs to go in the slideshow mode.
I can't see it now.
We can see it now.
I can't see it now. Hold on. Okay. Share screen. I just get a black screen now. Hold on. Sorry. A sharing screen. My screen just keeps getting black. Wow. Hold on. I'm sorry. Or share my screen. Barbara, can you pull up the slides and do share screen?
It will take me a minute because I don't have it open, but I can try to do that.
I'm sorry.
I'm gonna go off camera for a moment.
That is so strange. I apologize. I have a black screen right now.
Yeah, apologies, everyone. It's gonna take me a minute to get to the screen to get it open.
Right, and I am looking at a black screen right now. John, any suggestions from your tech staff?
You may want to stop sharing.
I have just a black screen right now on my laptop. Very strange.
It is still being shared, so because some of us can see it. So if you can stop sharing, I'll try to share.
I have a black screen. I'm trying to escape and nothing is happening.
All right. Let me see if I can share. I don't know if I'll be able to, if that's still up there, but let's see.
Um,
Okay.
All right. Can everybody see
Can people,
that?
can everybody see that?
Yes.
Yes.
All right. I'm sorry, Barbara. Thank you for your help. I guess we'll just. If you
Yeah,
can
just
do-
let me know. I guess I'm in control of it now, so just let me know
Okay,
when you need me
I
to
will.
go to the next slide.
Thank you. Oh, you can go to the next slide. Sorry for that delay. You can go to the next slide. Next slide. On the right-hand side of the screen is the definition of what a traumatic brain injury is. It's a blow to the brain caused by an external physical force. I often describe to audiences it's that jolt, that front and back motion that happens with the head and the neck. We often think of car crashes, falling down steps. These are also some examples: blunt and penetrating trauma, that jolt that is called the acceleration deceleration force. We often see traumatic brain injuries in military and veterans, and intimate partner violence. I guess we can go, and sports injuries. I guess we can go to the next slide. Thank you. So these are the next slide is the most common leading causes of TBI. And again, my screen just went, okay. My screen just went black. Can everybody see that?
Yes.
Okay. So these are the leading causes of TBI: falls, motor vehicle crashes, assaults, being struck by or against an object. You can go to the next slide, Barbara. Thank you. So brain injury is unpredictable in its consequences. Every individual is different prior to the injury. Every brain injury is different, and every person with a brain injury adjusts differently to the changes that result from their injury. When children and youth sustain a brain injury, as you can imagine, their brain is still developing, and they may experience difficulties even with mild traumatic brain injury. You can go on to the next slide. So brain injury is often called the silent epidemic. There's estimated that there are 5.3 million, somebody saying I should close teams. Yeah, I should close teams. Okay. There are about 5.3 million Americans that live with a disability as a result of a brain injury, and the New Jersey Commission on Brain Injury Research estimate that there are about 12 to 15,000 people who suffer from a brain injury event each year, of which 1,000 are fatal. And we know that these are underestimates, as I'd mentioned to you before, with brain injury often going unreported, untreated, undiagnosed. You can go to the next slide. What I like so much about this picture is the functions of the brain. I think we all take for granted all the functions that are controlled by the brain. The severity of the injury is based on where in the brain the injury took place and the severity of the injury. But I think it's just it's worth taking a look at all of the sections of the brain. Not that every person is going to have all of these problems or deficits. It's a pretty long list of tasks and functions that the brain controls. You can go on to the next slide. So a lot of people say, they have questions about left. You hear people say left brain versus right brain. So I'll leave this screen up for a second for you to read, and you can give the interpreter just a moment to relax. And then so there often we do hear people refer to left side strengths or right side strengths in our brain. And then the next slides, also the next two slides if you can go on to the next two slides, I'll leave this up for a moment instead of reading it to you. The sections of the brain are described here. Frontal lobe is located directly under the forehead and can be injured from direct impact on the front of the head. This area is responsible for executive functioning, which is a term you'll hear more about later on in this presentation, which is how we know what we are doing in our environment, planning and initiating activity, making judgments and decisions, goal setting, controlling emotions and self-monitoring, completing tasks and memory for habits and motor activities. I'll leave the definition of the occipital lobe up for a moment for you to read, and then we can go on to the next slide. And this is a description of the temporal lobe, where it's located, injuries associated with the temporal lobe and the parietal lobe. I'll leave this up for a second. And you can go on to the next slide. So that was a little bit about the anatomy of the brain. As far as the factors that have to do with the severity of brain injury, you will see terms such as mild, moderate, and severe, ranging from the factors would have to do with the period of time that an individual may have lost consciousness. Sometimes symptoms appear only 24 to 48 hours later, which contributes to the underestimates that I'd mentioned to you before. If you have mild and subtle symptoms and these symptoms don't appear for 24 to 48 hours later, and you do not receive medical attention, of course, that contributes to the underestimates, underreporting. So I'll leave the screen up just for a moment so you can see the differences on the continuum from mild, moderate to severe. And go to the next slide. So what happens often after brain injury, what you will notice if you are working with people who have a brain injury, there are often cognitive, physical, and behavioral emotional impacts. So looking at the screen that's on the right, that you're seeing right now, these are some of the cognitive changes and challenges that you will be seeing in referrals or consumers that you're serving. Memory challenges, intellectual function issues, judgment and abstraction, problems with multitasking, problem solving, attention and concentration, and distractibility. And after a brain injury, some of or all of our daily tasks may present significant obstacles that preclude an individual from successfully returning to work. And you can go on to the next slide. Some of the physical impairments that you will see, it's a long list. You may see people with some paralysis, balance, gait, and coordination issues, muscle weakness, spasticity, fatigue. These are common complaints, barriers and challenges you will be noticing in referrals that you receive when a person, is considering returning to work. Slurred speech, blurred vision, headaches. And we'll be getting into a little bit more detail on some of these issues as well. You can go on to the next slide. As far as emotional and behavioral challenges, these are most common reasons individuals ending up losing or quitting a job. Also, the rates of depression, anxiety, impulsivity, irritability, anger, and difficulty adjusting to a new brain injury are high. You can go on to the next slide. As far as psychosocial changes, I always like to make the point that educational and vocational issues for youth who are eligible for special education services, for children, youth, teenagers, age say 16 to 21, transition age students who are considering, applying to DVR, Many of these concerns, the families are having a difficulty planning for their vocational future. I would strongly recommend that you contact the Brain Injury Alliance of New Jersey Cares for Kids program. It's a free care management program that we provide statewide. We have a team of advocates, social workers, people who work their magic, actually do monthly home visits. We have they actually attend IEP and child study team meetings to assist the family. We have both Cares for Kids program and Cares for Adults, the Cares Care Management Program for adults. Prior to today's session, I sent a bunch of attachments to John. I'm hoping that you guys can get a hold of. One is a description of all of our programs and services, which you'll be seeing at the end. And yes, the care management program is available for adults. We also have a brochure, Return to Work After Brain Injury, for people who are considering returning to work and applying to DVRS services. We have also the brochure for the TBI fund, and we want to make sure at the end of this presentation that you have access to several of those documents. That's also a bilingual. We do have bilingual staff who speak Spanish for both the care management program and Cares for Kids. So I'll encourage you, if you do have a referral of a person who has a brain or a youth who has a brain injury, please feel free to reach out to us. It's a free service statewide. For families and family roles specifically, and that when we think about family issues and family roles, specifically if the client was the primary wage earner, if the client was the primary provider of childcare within the family, if your referral is unable to drive, and for really many other reasons, there are so many family issues and family roles that change once the person comes out of a rehab setting, out of a hospital. Life hits and they're inundated. Upon discharge from the hospital or the rehab, they're given a lot of resources and materials to read. And then you can imagine as life goes on, the stress that people feel with changing roles, somebody in the family unable to work, and so on. And I'll encourage you to call Brain Injury Alliance of New Jersey if we can be of any assistance at any time. As far as interpersonal difficulties, there's sometimes difficulties establishing and maintaining relationships and friendships. There is sometimes diminished recreational and social opportunities for leisure time activities. There are issues having to do with substance abuse, risk factors for use, abuse, and addiction. There are issues having to do with intimacy and sexuality, diminished self-esteem, self-awareness, and insight, and often a profound sense of loss, especially during the adjustment to a new brain injury. You can go to the next slide. Thank you. So we can get into a little bit about the stages of recovery and improvement after brain injury. Recovery is measured in weeks, months, and years. Usually most rapid improvement occurs in the first 6 months after the injury. The recovery from brain injury is a slow process and often incomplete. And what we have in parentheses, adaptive neuroplasticity, I thought I would define a little better for you, can be defined as how one experiences reorganized neural pathways in the brain. The brain has incredible capacity to change its structure and function in response to sensory impairments of the brain. In simple terms, it's the ability of the nervous system to change its activity in response to stimuli by reorganizing its structure, functions, or connections after injuries, such as stroke or brain injury. And in a couple of minutes, we're going to be getting into the utilization of adaptive devices, assistive technology, and apps. You can go on to the next slide. I'm not going to spend too much time on this. I did want disclaimer, that there is no one on the staff of Brain Injury Alliance of New Jersey who's a medical professional. Medical professionals do use these tests. Healthcare providers to use these tests to determine the severity of brain injury. I'll just leave this up for a moment for you to take a look at. And then you can go on to the next slide. So what we have here is the continuum of care. Yes.
His mom is here. She wants to talk to you. His mom.
I'm sorry. Somebody wants to say something? That's fine.
His mom.
Mama, I can't see it. Been with you tonight, and I can't look with him.
Okay, it's not him. His mother. It's his mother. Look at me. It's his mother. His mother's here. Not his. I know. Okay.
But then with you tonight.
19.
I
Okay.
don't have no really.
Okay.
I'm sorry. I wasn't able to hear that. Is it okay if I continue?
Yes, I don't think it's related.
It's okay. Okay, I think maybe okay. I think I'll continue. So what we have here is the continuum of care following brain injury. There are acute care hospitals and acute rehabilitation hospitals. Northern New Jersey is involved with something called the TBI model systems. Many of you might have heard of Kessler Foundation. It's a federally funded system that provide many people are familiar with the Kessler Institute for Rehabilitation in North Jersey. I think it's nationally and internationally known. We work closely with many of our partners around the state, large physical rehab hospitals. There are subacute care programs, residential settings, cognitive rehab programs, community-based programs, and of course, a multitude of outpatient services where individuals with brain injury could go for PT, speech, PT, OT, speech, neuropsychology, and of course, vocational rehabilitation services. So, you can go on to the next slide. Considerations for returning to work and determining readiness for vocational rehabilitation. The timing is very important. Individuals may consider returning to work soon or years after a brain injury. Some people are able to return to their old jobs, while others need to reevaluate their interests and capabilities in light of the limitations resulting from their brain injury. And cognitive, emotional, behavioral, and/or physical issues may interfere with a smooth transition back to the workplace, and increase in self-awareness and insight will aid in the development of a realistic vocational plan. You can go on to the next slide. And when we're talking about readiness for vocational rehabilitation, here's a few things that you might want to consider. Returning to work, as we mentioned, needs to be carefully timed. And is the client motivated to work? Is their health stable? Are there lingering symptoms? Does the client have the ability to perform sustained activities? Does the client have beginning awareness of strengths and limitations, and an insight into the changes that has occurred after their injury? What are the client's perceptions about their ability to work? And integrate input from the rehab team and, of course, the family. You can go on to the next slide. So here, you can go back. Yes. So here are some of the barriers to employment. Memory impairment. These are really just a few of the barriers. Memory impairments, difficulty concentrating, lack of compensatory skills, fatigue, possibility of depression, anxiety, and mood dysregulation, vision problems, speech and communication difficulties, headaches, use and misuse of drugs and prescription medication, and balance and mobility issues. It's probably much longer list than this. It's just a sample. You can go on to the next slide. So lots of people say, you hear the term soft skills and workplace etiquette. These are just some of the things that we have heard from people who have brain injury, people say they can't get to work on time. They're often late for appointments, or they don't remember what they have read. They're always losing things. When we think about soft skills and people being on the job, we've heard it in so many cases, people lose their job because they have difficulty with workplace etiquette or have poor soft skills. We've heard of people who steal lunch from the refrigerator in the staff room, lunch that belongs to other people, just using poor judgment. They may have been able to do the job, but there's something that got in the way regarding their soft skills and workplace etiquette. You can go on to the next slide. These are also some of the functional limitations that we may see with people who want to return to work or considering getting back to work. There may be issues having to do with balance, lifting, walking, strength and coordination issues, vision problems, hearing loss, and communication skills. There may be the person may be experiencing pain and headaches. Person may have poor attention span or is distractible, difficulty with reading and writing skills. You can go on to the next slide. So I've spoken to our care management team, as I'd mentioned to you before, who assists families statewide with quality of life issues after they come out of a rehab setting or a hospital. And in so many of the cases, when people are calling our free helpline or our care management program, they may need assistance with even applying to DVRS services. Of course, we're available to advocate. That team, our care management team, can advocate for people who are in the process of applying to DVRS to make sure that they have all of the paperwork and documentation that you guys would need. So we do talk to individuals who are interested in returning to work about the importance of applying to DVRS. And we know that DVRS provides services that enable individuals with disabilities to find jobs or keep their existing jobs. And an individual with brain injury may qualify for vocational services if the brain injury is a substantial impediment to employment. You can go on to the next slide. So here's a few considerations. Did the client return to work but was unsuccessful? Is the client currently working but having difficulty and in need of support services? Is the client in treatment or rehab and needs help to prepare for, find, or keep a job? Is the client currently in school and needs help finding and keeping a job? Has the client been in recovery from brain injury for an extended period of time and needs help finding and keeping a job? You can go on to the next slide. So as far as the vocational team, these are just, of course, as with many of your clients, these are the players. These are your, informants besides the consumer or the client. And of course, feel free to contact the Brain Injury Alliance of New Jersey if we can be of any assistance. You can go on to the next slide. So for the intake process and assessing, is there a brain injury or has there been a concussion or a series of concussions throughout the person's life. These are some questions that you might want to ask to include in the intake process. You might say to your client, did you ever have a brain injury, a concussion, or a loss of consciousness? If so, when? Have you ever been involved in an accident such as an automobile? Oh, I'm sorry, there's a typo there. A crash, where you have hit your head. If so, can they provide any details? What type of sports, hobbies, or recreational activities have you ever participated in where you might have hit your head? When you were a student, were you eligible for special, if you're talking to adults, when you were a student, were you eligible for special education services such as an IEP, resource room, untimed tests, special remediation class placements, and so on? And you might want to ask your clients, have you ever had a stroke, heart attack, brain tumor, or other medical problem that affected your brain? If so, what type and what was the outcome? And do you also ask if you have a history of alcohol and drug use? If so, have you ever participated or have been referred to any treatment programs? And if so, when? You can go on to the next slide. So at the initial interview, here are some questions that you might want to consider. Do you have problems with balance, lifting, walking, or strength? Do you have any problems with vision? Many of these questions you may be asking every client that comes through your door. Do you have any problems with memory, reading, writing, planning, concentration, or attention? Do you experience irritability, poor social judgment, social awkwardness, impulsivity? Currently, have you ever been diagnosed or treated with mental health, for a mental health condition? Do you have problems with and I would probably avoid the term activities of daily living. You might want to give some specific examples. If the person has a cognitive disability, you might want to avoid using a term like activities of daily living and actually give some concrete examples. Handling money is just one example. So asking the person if they experience seizures, if they've ever received treatment, and if at any point they were unconscious and for how long. You can go on to the next slide. And here's some clinical questions. Who is currently treating you? Health care provider, any specialist? Were you treated at a rehab center? Were you ever treated as a rehab center? What was the outcome? When was the last time you saw a physiatrist or neurologist, and what was the outcome? Are you currently taking any medications? And if so, which medications and what are they for and who prescribed them? How long have you been taking them? Have you had any side effects? And if so, have you discussed it with healthcare providers? And how do you keep track of medications if you are taking medications? You can go on to the next slide. And here's some more clinical questions. You're probably asking many of these questions to every client that you see. However, it's important to assess their possibility of a brain injury in their history. So there might be some observations during the initial interview. Is there paralysis or evidence of physical challenges? Are there speech and or communication deficits? Does the client have mobility or gait issues? Are assistive devices such as wheelchairs, walker, crutches, canes used for mobility? And, something about the client's appearance, their clothing, grooming, appropriate for job seeking or the weather. You can go on. Thank you. I wanted to share with you some of the accommodations that are mentioned in the Job Accommodation Network website. I will encourage you to take a look at JAN. JAN is the acronym, the Job Accommodations Network. And if you type into the field brain injury, you will see all of these categories where it says accommodation idea. You'll see lists of accommodation ideas and suggestions under physical limitations, visual problems, maintaining stamina. So I would just recommend that you take a look at the Job Accommodation Network following today's presentation. It will give you much more insight into suggestions that you might make in developing the vocational plan for people who have had a traumatic brain injury. And you can go on with the next slide. Thank you. You'll also see that many people with brain injury have consulted or have seen a neuropsychologist. This is the definition of what a neuropsychologist is and what a neuropsychological evaluation is. So you'd be talking, hopefully consulting a professional educated in diagnosing, treating, and helping patients manage many brain-related dysfunctions or injuries. And the neuropsychological evaluation, and you may be getting a report back from a neuropsychological evaluation, which includes the results of a battery of tests that assess brain health and mental functions. Of course, you'll be reviewing the results, review the recommendations for return to work issues, suggestions for compensatory strategies and vocational functioning to help develop the vocational plan. You can go on to the next slide. Also, the neurological assessments test a wide range of mental functions, including reading comprehension, language processing speed, learning and memory, visual spatial skills. And again, we see that term executive function. So we mentioned that the frontal lobe a couple of moments ago will impact frontal lobe damage may impact executive functioning skills. And again, these are some things we take for granted: planning, problem solving, attention and concentration, managing time, organizational skills. That you'll see results of after a neuropsychological assessment. And a neuropsychologist can perform assessments and interpret the results, but may not necessarily be familiar with vocational issues. You can go to the next slide. I do like to make the point that there are possible work-related relapse triggers for those with substance use disorder. These are just a list of few triggers you might want to consider. Substance abuse prior to a brain injury. There can be lower tolerance to alcohol and drugs after a brain injury. So what was substance use prior to the brain injury can become substance abuse or chemical dependency following a brain injury. These are just a few of the triggers: the payday, cash tips, rotating shifts, multiple prescription medications. Many people do pharmacy shopping, get prescriptions from many pharmacists. Access to illegal drugs near or at their workplace, transportation issues, too much free time, pressure on their job. There's also a lack of accessible 12-step meetings around the state and around the country. If the person uses a wheelchair, walker, crutches, or cane, they may actually want to attend a 12-step meeting. Most are not in accessible meeting spaces. We can go on to the next slide. As I mentioned to you, we are not medical professionals on the team at Brain Injury Alliance of New Jersey. I wanted to give you some information about common medications as it impacts people with brain injury. We also have a disclaimer on this slide that this is current as as of the creation of this PowerPoint in September 2024. Medication is often and research with medication is often changing. So we have consulted one of our board members who's a physician at a rehab hospital with many years of experience treating people with brain injury. And I did want to let you know these would be common medications that you may see as you're reading reports and documentation. Clients that you are serving, there may be pain medication in the offered, provided to the person who has experienced a brain injury, psychostimulants such as Ritalin and Adderall, antidepressants, which may impact major depression and anxiety, such as Prozac. Anti-Parkinsonian agents sometimes help to increase dopamine levels. I'll leave this up there for a minute. Antispasmodic medications provide relief from spasticity or muscle stiffness, and anticonvulsants to treat mood, pain, and seizures. I'll leave that slide up for just a moment. And we'll go on to the next slide. So there is a terrible triad, which research shows, studies have shown, suggest that insomnia, chronic pain, and depression frequently co-occur and are mutually interacting conditions. So we do have a few, sample questions. You may, and then we're going to just take a little deeper dive in the following couple of slides about sleep, mood, and pain. You may consider asking, does the person have difficulty sleeping at night? Do they nap? Do they take prescription or over-the-counter medications? For mood, you may ask, do you or have you ever experienced anxiety or depression? Are you taking medications or being treated for these? I seem to be getting some feedback. And for pain, ask if they experience pain or how severe that pain is. Are they taking medications for pain? If so, which medications? I don't know if everybody hears that noise in the background or if somebody can mute them. Thank you. As far as pain, there is pain frequently associated with traumatic brain injury if other parts of the body were injured, and you would want to conduct a needs assessment as to the extent of the pain, what's the current course of treatment, if any, and if pain is not being addressed, refer to a physiatrist or to a pain specialist that is knowledgeable about traumatic brain injury. At times, there are examples of off-label benefits. Botox is just an example in some cases of an off-label benefit and may alleviate pain by relaxing the muscles and may yield good results for persistent headaches if caused by neck or spasms. You can go on to the next slide. As far as sleeping disorders, your clients may mention to you they're not sleeping well, or they not sleeping well, or have worsened symptoms of depression and anxiety, fatigue, irritability. Sleeping disorders may lead to poor work performance and or work accidents. Studies suggest that sleep disorders are 3 times more common in patients who have traumatic brain injury. than in general population, and that nearly 60% of people with traumatic brain injury experience long-term difficulties with sleep. So these are some common sleep disorders. Could be insomnia, could be excessive daytime sleepiness and extreme drowsiness, a delayed sleep phase syndrome or narcolepsy, which would be falling asleep suddenly and uncontrollably during the day. And causes could be many, could be physical and chemical changes, changes in breathing control, prescription and over-the-counter medications, napping and physical inactivity, depression, alcohol use, caffeine, and nicotine. You can go on to the next slide. There also is a risk for seizure. Some studies show a low risk of seizure, except for penetrating injuries such as gunshot, intracranial hematoma, and prolonged coma. Seizures can occur after traumatic brain injury, although most people with TBI will never have a seizure. 1 out of 10 people who are hospitalized after a TBI will have seizures, and most seizures happen in the first few days or weeks after a TBI. Some may occur months or even years after the injury, and about 70 to 80% of people who have had a TBI and who have seizures are helped by medications and can return to most activities. You can go on slide. So we can talk a little bit about accommodations to enhance vocational outcomes. These are just a few. When the person is considering return to work, some conversation would benefit your clients to talk about, is there a structured waking sleeping schedule? Do they need some structure with their work tasks? The development of stress management techniques, assistance with money management skills and time management. Building positive relationships with coworkers and supervisors, establishing reliable transportation options, and assistance with remembering instructions, especially important as someone considers return to work. You can go on to the next slide. I did want to offer you some information about assistive technology and aids. There are many different types that are available and that are helpful. For an example, Lumosity is just one app that has 40 different games to improve attention, flexibility, memory, and problem solving. There are lists and lists of apps and technology, assistive technology, and items that can be on somebody's phone or laptop or tablet, designed to integrate effortlessly into someone's daily routines, whether at home, work, or on the go. There are apps that will provide up-to-date, fact-based information, encouragement, and support to help start and keep healthy habits for your brain, and speech generating devices, which will improve communication to help one express thoughts, practice speech, and regain independence. I'll give you a couple of referrals at the end of this presentation regarding organizations that can help with assistive technology. We hope you reach out to those organizations, local organizations within New Jersey. So as for many of your clients, of course, we always say volunteering is an alternative at this stage when someone is considering getting back to work. They can, I'm sure you mentioned to many of your clients who are considering getting back to work that networking and making new contacts and meeting new people as one considers getting back to work, of course, would be advantageous. It will help to improve job skills, gain work experience, enhance your resume, build self-esteem and confidence, improve one's health. You feel needed and valued. It really can make a difference in someone's life, and also find out about new job opportunities that are available. So at this crucial point, when people are considering returning to the type of work they did before or trying a new type of employment, volunteering is an alternative. When so many decisions need to be made, if someone is going to be considering going back to the same type of work they did before or trying something new. On to the next slide. I wanted to make again sort of summary of some of the things that we've discussed. Every individual with a brain injury brings a unique set of strengths, skills, interests, capabilities, and challenges. The family rehabilitation professionals, supported employment specialists, and DVR counselors will help the individual who has experienced a brain injury find and keep a job that maximizes their capabilities and provide strategies to minimize areas of weakness. Clients may have trouble generalizing from one situation to another. What is seen on an assessment may not generalize to the work setting. Clients may not have a realistic appreciation of their functional level post-brain injury. And remember that not all clients with a brain injury will be able to successfully return to work. Consider a gradual or part-time return to work or volunteering when appropriate. I did have a case study for you, and I would be happy to have any if people wanted to unmute. I wanted to present a case study and then ask a question. And of course, any feedback from any colleagues that are on this call who have had a person with a brain injury on their caseload, and please, feel free to share any successes, challenges, or barriers that you confronted. But as pertaining to this case study, there is a middle-aged female with a brain injury from a motor vehicle accident, from a crash. She describes experiencing memory issues, confusion, and fatigue. She's requested supported employment services following a long, solid, that's a typo, I'm sorry, a long, solid work history in her preferred field. And her goal is to transition from part-time to full-time employment, to no longer utilize SSDI, and to increase her income. So my question to the participants in today's session is, what strategies would you use in the development of a vocational plan to move this client toward competitive employment? And what types of barriers to employment would your client need to overcome? Is it okay if we just take a moment and unmute if you ever have had a person on your caseload with a brain injury, any barriers and challenges as per this case study?
Are we supposed to just speak up, or did you want us to put questions in the chat?
No, absolutely feel free to speak up. Thank you.
I just want to talk. I did have a client that had a brain aneurysm, and she had to learn everything from scratch, from talking, from writing, and she used to be our job coach, and then she became our client, and she had to learn everything from scratch, it was very severe, that brain aneurysm, but she survived it, and she had to learn how to drive again. What really helped in her case was that she went to Moss Rehab at the time. Moss
Okay.
Rehab, she had a lot of therapy and everything, and learned everything back. Everything came back to her,
Right.
like
Right.
the rating, and then she went back to work, and she started driving again. So yes, that was a very successful case that we had.
Great. Thank you for sharing that. I appreciate it. Yeah, if anybody else had anything to add. No, as I'd mentioned to you before, part of the team can be our care management team. Please consider having your clients contact our free helpline. We do have staff that are bilingual and speak Spanish. We have staff who are social workers and advocates who do monthly meetings, who attend meetings, so that people, both children and adults who have brain injury and their family members, can access whatever types of services they need to improve their quality of life. They may need assistance with the application process, even with applying to DVR. So please feel free to reach out to us. I will,
Debbie,
yes.
it's Barbara. Somebody did put something in the chat. I don't know if you saw it, so I just want to make sure that we get to that. So it says, I lost it here. Doing an assessment to see if accommodations can help with organization and memory, and also suggested contacting Jan. And then let's see what else. Work with an employer to provide education for flexible work schedule. So those were some responses to this.
Right.
And then someone also wrote, referring to this, will this client be eligible for TBI fund because it is a motor vehicle crash? And I would say, I'll step in here and say,
yes.
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 We'll talk about the TBI fund in a
Yes.
moment.
Yes. Yeah, we're going to be talking in more detail about the TBI fund in a moment. Yes.
Hi.
Hi.
This is Lynette. I had a client a few years ago that also worked with Moss. She had a stroke. She also, part of the difficulty that we faced was for her to accept her current barriers. She worked in an office and she wanted to go back in that setting. But because of, she was older, and because of the major part of her disability was memory. She could not remember a lot of stuff that she did before, but she wanted to go back into to work in the office. So it was a task getting her to understand that presently, as her disability is, she was not able to go back into that work environment. And we did a lot of work with her. She finally accepted her, her status at that time, which is a couple of years ago before COVID. So we were able to get her to work. She was hired at Walmart as a greeter, so until COVID, she lost a job because of COVID, but she was successfully employed there for, I think, a little over 3 years before. So for that client, the issue was getting her to understand and accept, that current situation as a result of the stroke that she had.
Yes, I have heard that from clients where people say they want to return to the work or the type of work they did prior to the injury, and may be unsuccessful in that regard, and then need to try some with the guidance from DVRS, try something else that they'd also be interested in. Yeah, thank you for offering that story.
You're welcome.
I know, I guess I would just wait one more second if anybody else had anything to offer.
Hi, my name is Jennifer from the DVR office in Sewell.
Hi.
So we had a great working relationship with Moss Rehab in Woodbury.
Okay.
We were able to send a lot of our clients there for core evaluations and neuropsychs, and was able to really provide us a lot of insight into the barriers that an individual would have due to a brain injury, or if they were able to work in the community, giving us some interests and strengths and weaknesses. It has become so hard in the South region because Moss Rehab is no longer in Woodbury and they are in Philadelphia. So we have some of our clients that are willing and able to travel over to Philadelphia to conduct those evaluations. But if they're not willing to go over to Philly, we really are disadvantaged not having vendors here in the South region to provide us updated evaluations to assist individuals with brain injury. So it is some type of a barrier that we do
Sure.
face in DVR. Having, updated evaluations is needed to provide us some insight. So we are having a little bit of a struggle in the South region. And we've had this discussion with a lot of our managers and supervisors are aware. We have told our local DVR offices and also our Trenton office about, this barrier that we're facing. So that is something that the South does face
Sure.
when coming and helping individuals.
Sure, thanks for making that point. That has been brought to my attention. I have heard that in the southern part of the state, there's a lack of service providers. Yeah, thanks for bringing that to the attention of all of the attendees today. I don't know if anybody else had any comment.
I'll just add to that.
Right.
We know in general that yes, there's a lack of service providers in the south of the state. I want to just note that BIANJ has an app which you can download. I can't think of exactly what it's called at the moment. I can get you that, which lists various service providers who have some familiarity with brain injury throughout the state. So there are some neuropsychs included in that. There may be some rehabs. So it may be helpful. It may only, list already the places that but it might be helpful to find places. And also we can ask our director of support services if she has any, knowledge of any rehabs and facilities in the South. Again, you probably know what's available, but we can sort of just check and see if there are any additional resources that we might know about that would be of assistance to you.
Sure.
That would be great. Thank you so much. I truly appreciate it.
Thank you, Barbara.
I see in the chat, I'll get you the name of the app. I can't think of it at the moment. You can download it. You know what? Let me just grab my phone. I've got it, and then I can just tell you what it's called. If you look up, when I open it, it's Welcome to the Brain Injury Alliance of New Jersey Resource Center. So it's the resource app. And if you can get it at, wherever you get your apps, Apple or Google. And if you look up BIANJ or Brain Injury of New Jersey, you should be able to find the app.
Wonderful. All right, that would be great. Thank you, Barbara. We have about 10 minutes left. I want to make sure to cover our Brain Injury Alliance of New Jersey programs and services. Of course, if you had any other questions, please put them into the chat. Barbara, we can go past these. I think there were 2 other case studies, which we do not have to cover today. If you could just forward past case study 2. Yes, we have a list of national resources for you. I mentioned the Job Accommodations Network and the Model Systems program. It's a research program associated with Kessler Foundation, Brainline, the Brain Injury Alliance of America, and the U.S. Brain Injury Alliance, NASIA, as well as the CDC. You can go on to the next slide. There are local resources in New Jersey. Of course, make a note of our 800 number, check our website, sign up for the e-news subscription. You're going to be hearing in a couple of minutes about the New Jersey Division of Disability Services TBI fund, where so many people can benefit from that fund. As far as assistive technology within New Jersey, we'll encourage you to reach out to Advancing Opportunities and Disability Rights of New Jersey. We're very fortunate to have that kind of expertise in New Jersey. Here are a couple of other phone numbers that you might use as references. And I think I am going to turn the microphone over to Barbara. I wanted everybody to know about the New Jersey TBI fund. Barbara, if you wanted to take it from.
Sure. Thank you, Debbie. So if somebody already mentioned the TBI fund, you may be familiar with it, but just in case, we'll just give you a little bit of information. So it is a fund that provides for New Jersey residents with TBI to purchase brain injury related services and supports that they need. I want to emphasize that it is a fund of last resort. So if somebody has, Medicaid, Medicare, private insurance, that would be used first. And if it is a service that they need that is not provided through whatever kind of insurance they have, if they have something, then they could apply for the TBI fund to pay for it. So there are some things that, for example, that may get covered is, some home modifications, if you need a bathroom made accessible or a ramp or something like that. Cognitive rehab is sometimes covered, household management, life skills management, financial management, those kinds of things. So it is a fund of last resort. The applicant must provide medical documentation of a traumatic brain injury. And again, I want to emphasize it's traumatic brain injury. So someone that has, had a brain aneurysm or a stroke or something is not eligible through this fund. So I just want to be clear about that. Person needs to have liquid assets of less than $100,000, and they need to be a resident of New Jersey for at least 90 consecutive days. It's run through the Department of Disability Services. There's a link here, but you can look up DDS TBI fund, and you can get to the information and information about applying. There is an application. When you put in the application, then the client, potential client, would get assigned a case manager. Case manager would do sort of an intake interview and assessment with them. And then the case manager writes up a service plan that gets submitted, and the service plans get reviewed and approved or denied. If it's denied or modified for some reason, it goes back to the case manager. Case manager works again with the client to kind of tweak it as requested, and then it kind of gets sent back to the review committee again. And I just want to note, in case people don't know where the money for the fund comes, any of you that drive, that have a car that is registered, 50 cents from every registration in New Jersey goes into this TBI fund. So you are all, any of those of you that have a car that's registered in the state, you are all contributing to the fund. And it is a really important resource for people that may not be able to get certain services that they need otherwise. Let's see, I think I saw a couple things in the chat here. Just want to, okay. So we have a video, but in the interest of time, I think I'm not going to show it right now. It is a TBI video. We can send it to John, and he can send it around if you want, but pretty much just shares more information that I just stated about the TBI fund. So we can get that to you. I also want to just note that we had a couple of different drafts of this presentation as we've been sort of tweaking it and reviewing it. And in the interest of time, again, this morning when I was trying to find it, I did not pull up the very, very last draft. So Debbie referenced there were a couple of typos on there and a couple of very minor tweaks. So when we send it out to you, we will send you out the most, the latest correct version. So apologies for that. Okay, so I just want to take a moment to talk about BIANJ's programs and services, some of which Debbie already mentioned. So we have our direct services. So we have our CARES program, which is our, our case management program. I believe Debbie mentioned we have CARES for kids and we have the CARES for adults program. And that is a, you know, it's a care management program. So somebody that applies to the program, we do not, unlike the TBI fund, we do not require sort of a medical documentation of a TBI. We hope that everybody, you know, has one. It doesn't have to be TBI. It can be an ABI for our care management program. Someone would be assigned to a resource specialist. The specialist would go out again and do an assessment, meet with the client, family, and you know, and determine how they can be helpful. And it may cover things just like providing emotional support, connecting the person to resources. If it's a child, maybe it's going to the school with the family, you know, for a meeting. So, you know, it's a variety of sort of care management services. We have a peer mentor program. This is a new program. We had done it many years ago, and then we kind of returned to rebuilding the program. So we have a mentor who you know, has had a brain injury, been living with it for a while, and is a little bit more experienced kind of managing their brain injury, and they are paired with a mentee, someone who is sort of newer to the brain injury experience, and you know, to sort of help them and provide some support for them. We have our helpline, which is a Monday through Friday, 9 to 5, so it's not an emergency line. But again, any kind of questions, inquiries about brain injury information, resources, you can call the helpline. And we do, as Debbie mentioned, have a bilingual coordinator. So if someone has the need for Spanish speaking, then you know, we can get back to you with somebody that speaks Spanish. We have support groups throughout the state. Some are virtual, some are in person. Some are for caregivers, some are for people you know, with brain injury. We also do have some groups, like we have a book discussion group. We have a I think we have a mindful arts program where, you know, there are people talking about sort of various type of art, cultural things. So we do have a number of different kinds of support groups. And then we have Camp Trek, which is our 1 week camp that just took place about a month ago in at a camp down in South Jersey for adults 18 and over with brain injury. It's a week-long camp where overnight, where you know, we provide sort of camp activities for the campers, and it's also a respite opportunity for the families. Then we do have our education component. So we do workshops such as this for and you know, wide variety of topics in various different settings. We have webinars. We have them about once a month. We actually had one this morning at the same time as this on concussion update. We'll be having one later this month. You might be interested. I believe it's September 24th on fall prevention strategies. And then we're having one in next month on helping people deal with sort of trusts, setting up trusts for you know, special needs folks. So we have a wide variety. I would encourage you to go on our website, and you can find all of the webinars, and the ones that are already scheduled for throughout the year up there. You can register for them. We have our trainings, regional trainings for health and human service professionals, such as yourself. We will be having these in March. And these are free trainings. We have one in the north, which will be at Kessler in East Hanover, and then one more south, which will be at Cherry Hill Public Library. And these are a great way to just, for people who are already working with people with brain injury, or people who want to learn more about working with people with brain injury, to you know, to get some information. This year's the focus on the trainings will be building an interdisciplinary team to work with the brain injured. So that would be something that, again, perhaps some of you might want to attend. We have our annual professional seminar, which will be May 14th, 2025, and that is a full day training. That is not a free training, but that is a seminar with, we bring in a keynote, and we have various workshop sessions throughout the day. It's a great educational day. And then we have a Family Fest, which is a sort of family, social, recreational, educational day. It usually takes place in June. We also have an advocacy person that works on legislative work, as well as sort of self-advocacy training for people with brain injury. And they work at the state, local, and federal level in terms of advocacy and legislation related to brain injury. And then we have our prevention side of things. We have our Champion Schools program, where it's a program for high school students on distracted driving. Anybody that wants more information on that, you can let us know. We have a website, Jersey Drives, that deals with prevention education on pedestrians and driver motorcycle safety. We have a program, Heads Up for Seniors, fall prevention program that we do in senior centers and elsewhere. So I think those are our programs. I also want to note that we do have a monthly e-newsletter. So if anybody is interested in getting the monthly e-news and it has information about all of these programs and services, you can either send Debbie or myself an email, or if you go onto our website, BIANJ.org, as soon as you open it up, a screen pops up that asks if you want to, get more information, and you can sign up that way. I will stop there as we're approaching our time. If there's any questions, feel free to let us know.
Yeah, we are. I wanted to also make the point that our annual professional seminar that Barbara just mentioned, May 14th, 2025, will be at the Palace in Somerset, a full day opportunity for professionals in many disciplines will be coming for their continuing education credits, and that we do offer CRC credits. If anybody wanted on this call, or any DVR employee wanted to learn more about this topic, that would be a great opportunity. And of course, thank you for the opportunity to do this presentation today. We hope that you can stay in touch, check our website, subscribe to the free electronic e-news, which is jam-packed with information and resources, and please stay in touch with our office. Thank you.
Thank you both. Thank you both, Dr. Chabner and Debbie. And just a reminder to please complete our survey, especially if you receive credits. And thank you to our sign language interpreters. And we truly value this wonderful information and how we could apply it to our consumers. And it's very helpful. And we wish everyone a wonderful day, and thank you again. Have a great day.
Thank you.